Hey, welcome everyone to our webinar today on improving your fine motor skills through LSVT BIG. And we hope that the next hour for you is really useful information, whether you're a person with Parkinson's that maybe has some struggles with fine motor skills, maybe you're a caregiver or a family member, or maybe you're just a clinician looking to learn a little bit more. So today, my name is Laura Gousset. I'm a physical therapist and one of the LSVT BIG training and certification faculty, and I'm joined by my colleague, Julia Wood, who's an occupational therapist and also one of our LSVT BIG training and certification faculty. So we're just really happy to have you, and I'll be starting off the presentation today, and Julia will join us a bit later on. And here's our bios. I won't read through them, only to say that Julia and I are both highly experienced in providing LSVT BIG to our patients with Parkinson's and other neurological disorders. And Julia has much teaching experience, not only with LSVT BIG, but she's a certified facilitator for the PD Self program, and she's also faculty for ATTP. And if you're joining the upcoming World Parkinson's Congress, you can check her out with a virtual presentation there as well. So a few disclosures. I'm an employee of LSVT Global and receive lecture honorarium, and Julia is a consultant for LSVT Global and also receives lecture honorarium. And we both have a treatment preference for LSVT BIG as a treatment technique. Now, you might be joining this webinar for the very first time using GoToWebinar. So just some logistics in case that's true for you. Right now, your microphones are muted automatically, so there's no background noise from all of the different environments that you're joining us from. However, at the end of the webinar, if we have a few minutes left, we'll have an opportunity to ask questions either by typing in questions, or you can unmute your microphone and have the opportunity to ask your question out loud. At any time during the webinar, feel free to type your question in on the control panel. There should be a tab that either says questions or chat. And if a question comes up that you want to be sure to answer, get an answer to, we'll answer those in a first come, first served basis at the very end of the webinar. In the control panel, you should also see something called handouts. If you click on that, you can find a PDF of the slide handouts from today's presentation. Feel free to download those, save those, print those off for your records. Those will also be uploaded to our blog where our on-demand webinars are located. So this webinar is being recorded. If you want to listen to it again in the future or share it with someone else who might be interested, usually takes a couple of days to upload it to our blog, and there you can find it under the webinars tab. If you can't find the handout, you can always email us at webinars@lsvtglobal.com. At the very end of the webinar, there should be a survey link that comes up. If you have a few minutes, we always value your feedback. Just a little bit of information if you're a therapist who's joining us, so you know about continuing education units. The LSVT Global webinars are not registered or pre-approved for continuing education units, but if your state allows for self-report, we will provide you with a certificate if you'd like one. Just email webinars@lsvtglobal.com to request a certificate, and it'll take about 1 to 2 weeks for that certificate to be emailed to you. You do have to attend for the full hour duration of the webinar in order to earn that certificate. If you're not sure about your state requirement, the best thing to do is to contact your state board and see if self-reported CE activity is applicable to you. So in terms of what you'll learn, here are the learning objectives for today. We'll start off by providing examples of fine motor tasks and talk about how they're impacted in Parkinson's disease. We'll then move on to talk about how LSVT BIG as a treatment is used to address difficulties with fine motor control in Parkinson's disease. And then Julia will talk to you more about what an LSVT BIG session looks like in case you're not familiar with that. At the end, we'll give you some information about how you can get started with LSVT BIG if you're a person with Parkinson's and is interested in this treatment approach. So as a company, LSVT Global's mission is to really empower people with Parkinson's disease. We know that medication is extremely useful in symptom management, but we know that there's so much more that can be done in terms of symptom management through therapy. And that's really our goal, is to help people maintain their highest levels of communication, mobility, and independence in activities of daily living through our programs. LSVT Loud is a speech treatment, and LSVT Big is a physical and occupational therapy treatment. So today in our webinar, you will be hearing both from me, a PT, and from Julia, an OT. And we just want to let you know right away that LSVT Big can be delivered by either or in a combined approach. And so at the end, we might talk a little bit more about that as well. But let's get started on the topic at hand, which is fine motor tasks. So if you're not really sure exactly what does that mean, think about tasks that require precise manipulations of your hand and finger. And so much of what we do as human beings are fine motor tasks. If you think of precise things like, the tiny clasp on a necklace and opening it, twisting a water bottle to get it open, or your pill bottle to get it open, texting on your phone. There's just 1,000 things that we do every day that require that precision of our finger movements. In addition, it requires steadiness of our hands, coordination, adequate muscle control, proprioception, which means that we can feel the movement, we can feel the position of our fingers that they're in, and sensation. We all need that to be able to make accurate and discrete finger movements. And here's some additional task examples. And we'd love to hear maybe in the chat, what are the things that you struggle with related to fine motor control? Some of the examples listed here are buttoning, handling money like change, or even taking bills out of your wallet. Handwriting, for sure. We hear that in so many people with Parkinson's disease. Typing or texting, using jewelry, tying shoes, picking up tiny objects, like things like pins or paper clips or things like that you have to grasp with a really precise grasp. We know that 75% of people with PD have micrographia, and micrographia is just a fancy term for meaning tiny handwriting, small handwriting. So all of these things can be problematic in people living with Parkinson's disease. Additionally, many people with PD experience tremor or shaking of one or both hands, and it can be very mild and subtle, and it can be more severe. Typically, it's a resting tremor called a pill rolling tremor, but it can also impact a person's ability to manipulate objects, such as bringing their spoon or a fork to the mouth, writing without it being so shaky that it's not legible. Bradykinesia and hypokinesia are two things that are targeted in the LSVT Big treatment. Bradykinesia means slow movements, and hypokinesia means small movements. And so it just takes longer to do activities, even fine motor activities, because the movement is slower and smaller than it needs to be. People with PD often also have impaired kinesthetic awareness. And what we mean by that is inadequate sensation or awareness of a person's position or their movement. So a lot of patients that I've treated with Parkinson's disease aren't really aware that they're walking with a closed fist, or that when they're attempting to do something like a fine motor task, such as buttoning, their fingers really aren't moving at all. They're very rigid, and the person doesn't feel that or perceive that they're not moving very much. Difficulty sustaining repeated movement. I think of a lot of my patients who do repeated movements with playing an instrument or typing, or even handwriting, where they're making loops or different letters in cursive or in print, and have difficulty sustaining the amplitude of that movement. By the end of the line, it becomes kind of a one-line scribble. And then lastly, difficulties with initiation of movement, getting movement to start, and difficulty stopping movement. And I think that goes also back to that handwriting example I gave you of starting off writing quite well, and by the end of the the line, it begins to get so small and tiny that it's not legible, but not recognizing that you need to stop, wiggle your fingers around before you start again instead of continuing on with this very tiny handwriting. And the last of these problems and the ways that fine motor tasks is impacted by Parkinson's disease is something called dyskinesias. Now, dyskinesias are excessive movement, abnormal movement that are simply a side effect of dopamine replacement therapy. It can affect the limbs, it can affect the fingers as well, and it's creates some difficulty controlling movements when doing fine motor tasks. So what are the causes of fine motor control issues in PD? Didn't mean for those to all pop at once, but I'll talk about all three of them. The first starting with limb kinetic apraxia. Now that's a really long term, and you might be thinking, what exactly does that mean? Well, limb refers to our, arms and legs. Kinetic refers to movement, and apraxia refers more to the action of doing something. So people with apraxia, they know what they want to do. They have the capability, they have the muscle control to do what they want to do. They just can't get those fingers in hand to behave and do what they want them to do. And the author of this study related to limb kinetic apraxia defined it as a loss of deftness with decrease in the ability to correctly perform independent but coordinated finger movements. There's also what we call a somatosensory processing deficit. So another big word, but you pick up on the key sensory processing within that. So it's not as if you can't feel the coin or feel the cap to your pill bottle, but it's really feeling what that movement feels like and your brain integrating it and giving feedback. So it's due to a change and interplay between these two different parts of your brain that are affected by PD called your basal ganglia and the supplementary motor area of your cortex. Overall, the underlying basis is poorly understood. There's a lot more work that we need to do in research to understand what actually causes that detriment in fine motor control in people with Parkinson's disease. Unfortunately, dopamine replacement therapies such as Sinemet or some of the other drugs that are common to PD don't really help a lot with this limb kinetic apraxia disorder. It's fairly insensitive to those therapies. Now, the second of those causes is bradykinesia. Bradykinesia is slow movements. Those are responsive to dopaminergic therapy. And the last that causes problems with fine motor control is often tremor or that shakiness of movement. And that tends to also be responsive to dopaminergic therapy to some extent, especially in the earlier stages of the disease. And then over time, perhaps because of gradually decreased use of your hands, it's common to have mild reduction in hand strength. But that usually doesn't happen early on as a primary symptom of Parkinson's, but rather perhaps a secondary effect of non-use over time. So take a look at this sentence here. The person with Parkinson's was attempting to write whales live in the blue ocean, which is part of a standardized assessment. And you can see that even though I enlarged on the screen here, it's very, very tiny. And maybe if we got out a microscope, we could make out a few of the letters, but overall it's not legible. And it's, I'm sure, very frustrating for the person that's attempting to write legibly that that's how it comes out. And so think about the fact that even small movements like handwriting, putting in earrings, putting on mascara, even small movements are much too small in people with Parkinson's disease. So I'd love to know, and I'm sure Julia would love to know too, if you are a person joining us today and you have Parkinson's, have you experienced any difficulties or changes in your fine motor control? And if you just give me a second, I'm going to pull up a poll so that you can answer this question live and give us a little bit of feedback here. So the poll has been launched and you can just answer that question, yes or no. And we'll give you maybe 10, 15 more seconds to give everyone time to answer that question live. Just a few more seconds here. Looks like some people are still voting. Okay, so it looks like we have 80% said yes and 20% said no. And that's really interesting to me because that is almost exactly the same statistics as I shared on that slide about what percentage of people have difficulties with handwriting that have PD, and that was about 75%. So thank you for sharing that. Okay, let's get back to our show here. So here are some ways that your physical or occupational therapist may assess your fine motor control. The most important is to talk to you. We want to find out what is difficult for you related to fine motor control. And if you have a hard time coming up with some of those ideas, oftentimes your therapist will just really talk to you about a laundry list of fine motor activities that might trigger some aha moments like, oh, yeah, that really is a little bit difficult for me. And that will help your therapist to determine what type of functional activities to practice during therapy. So we really want to know, what would you like to do? Because we're confident that we can help you to do that better through an intervention like LSVT BIG. They might also do some dexterity tests, and occupational therapists in particular are really the experts at this. Here's a few examples in case you've heard of these before. There's one called a 9-hole peg test where you're manipulating these pegs and putting them in holes. There's another one called the Purdue pegboard. There's a test called the manual ability measure. There's a dexterity test called the coin rotation test where you manipulate a coin between your thumb and forefinger. So there's just a variety of different ways that they're able to assess your dexterity. They might also do some handwriting tests, and there's some standardized versions of those as well, or they might just ask for a sample of your handwriting on the spot to see, are you able to write legibly? Is the amplitude, the bigness of those letters adequate? And are you able to sustain that writing several sentences or even paragraph? Also, they might do some functional tests like timed fine motor tasks. So maybe if they'll give you a button-down shirt and say, okay, I'm going to time you and see how long it takes you to do all of these buttons, or how long it takes you to put on this necklace or thread your belt, you know, really whatever it is that you have identified as being difficult for you. There's also some other functional tests that are more standardized that they can use, such as the patient-specific functional scale, and there's one called the Performance Assessment of Self-Care Skills. So how do we address these issues with LSVT BIG? And the overarching principle is think big. Like, no matter what you're doing, whether it's a fine motor task or a large task like getting in and out of bed, the principle is always going to be, I'm going to do it bigger and with more effort. So our next polling question is this: if you are a person with Parkinson's or another neurological condition, have you received LSVT BIG treatment? So again, oops, I'm going to go ahead and launch this poll. Just give me a second. Okay, and you should be able to see the poll up on your screen right now. Just let us know if you've received LSVT BIG already or if you have not, if you're a person with Parkinson's. And again, I'll give you about 30 seconds. That means you have about 15 seconds left to vote on this. Okay, and it looks like everyone is done voting. So I'll go ahead and close this poll and share that with you. And it looks like about 36% of you have. So that's great, fantastic, glad you're joining. And 64% of you have not. And hopefully this information will be really useful to you as well. Okay. So let's talk a little bit about LSVT Big, and then Julia is really going to get into the nuts and bolts of how this therapy session works and what a session looks like. So how do we use LSVT Big to improve function with fine motor tasks? It's really all about amplitude. So amplitude means the bigness or the size of movement with everything that you do. You see in the picture down here, this man that is walking with a cane. He's bent over a little bit. His feet are very close together, meaning that he's not taking very long steps. And as the therapist drives amplitude and says, longer steps, bigger arm swings, stand up with bigger posture, everything is big, 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 and drives that amplitude, there is a spread of effects that happens. And it's just really wonderful to see, both for the person that is receiving the treatment and for the therapist. Not only does the amplitude or the bigness of the movement improve, but many other things improve, like the speed of movement, the coordination of the movement, posture, balance, many other things. And that can also extend to fine motor tasks. The mode of LSVT Big is an intensive and high effort treatment because we know that it really takes excuse me, a lot of effort to override that tendency to move small and to move slow. And it takes a lot of repetition of practice to make this bigger movement a new habit. The minimum dosage that's established as being efficacious in the research studies is 4 consecutive days a week for 4 weeks, so 16 sessions of treatment, all in 1 month. These are hour-long sessions, one-on-one with a therapist, so it's not group therapy because the intervention is completely personalized for you. That therapist needs to have their eyes completely on you and no one else so that they can give you the appropriate feedback throughout the session. You'll also have daily homework practice and daily carryover exercises all 30 days of the month that help you to get in the routine of practicing these exercises. So once you're done with therapy, you can maintain the gains that you worked so hard for. Now, don't let the homework scare you off a little bit. Typically, it takes 15 to 20 minutes per day. It's always delivered by therapists, physical or occupational therapists who are certified in LSVT Big. So they actually attend a training and certification course from LSVT Global to learn how to deliver this treatment correctly. Our goal for all of our patients that undergo LSVT Big is something called calibration. And this goes back to that sensory disorder. Oftentimes, what happens in Parkinson's disease is movement that is actually too small or too slow feels fairly normal to the person with Parkinson's disease. So there's a mismatch between what the person with PD feels and actually what is coming out in terms of movement and how others perceive it. Sometimes when we get people, our patients, moving bigger and the therapist is saying, wow, that looks fantastic, and what we see as movement experts as being completely normal movement, it feels too big for the person with PD. And so that we've heard this quote before, I can't walk like this. People will think I'm crazy, even though the movement comes out normal. So that's our goal, and that's part of the reason why it takes such an intensive treatment, because truly by the end of 1 month of treatment, you will have learned that, yes, this is the effort I need to give in my movement so that it comes out more normal, more independent, I'm more efficient, I'm faster with my movement, I accept it, and I love it. It really helps me in everyday life. So with that, I'm going to turn it over to Julia, and she's going to walk you through an LSVT Big treatment session, and I'll talk with you a little bit more at the end.
Thank you so much, Laura. Great job. And thank you all for joining us. So let's get into what this looks like. I know you're probably pretty curious. So let's take a overarching look at what an LSVT Big treatment session would look like. So basically, there's a set of core large amplitude exercises. There's 7 exercises total. that work to really increase the amplitude of your hand and finger movements and also really increase your awareness of hand posture and function. So that's a way we address those fine motor changes within these exercises that are also working on a lot of other things as well. So then you're also going to do some functional tasks specific practice. So let's say you come in and, we might do some of those assessments like Laura mentioned, where we're checking in on, what are you having trouble with? What's bothering you in your day-to-day life? And you might have things like, doing jewelry or, buttoning your cuff button, getting items in and out of your wallet. And so then what we're going to do is make those part of your program, practicing how to apply that amplitude to your finger movements within those functional tasks that are relevant and meaningful to you. And there's a lot of research coming out that really supports the role of motivation in how you are able to improve. So our brain, our basal ganglia, that area of our brain that's affected with Parkinson's, actually motivation really helps to drive and move that area and challenge it in the brain so that you can get better at these things that are really meaningful to you. And there's always going to be home exercise practice. So we're going to be giving you a home exercise program that you can and should do every day for the rest of your life that's specific to trying to counter these effects and counter these changes to the movement with Parkinson's, both, gross motor, so your big movements like taking bigger steps or moving your arms bigger, also balance, but then also those fine motor elements as well. And every single day, we're going to give you carryover assignments as well. And the idea behind a carryover assignment is giving you that practical, real world application and practice so that you see how you can change your movements in your everyday life and use those concepts of amplitude in your movement to do things better all the time, be it getting the mail or going to the grocery store or maybe doing work tasks, keyboarding, maybe picking up a grandchild, whatever it might be. We're going to weave those into your program so that you're taking these elements from the exercises and the functional tasks and really applying them in your everyday life. So these are pictures of the standard large amplitude exercises here. And so you notice that two of them, if you look at the top left corner, the first two exercises are seated and working on big posture, big reaching, big rotation through the spine. So if you think about these movements, these are going to help with posture when you're sitting and eating or doing desk work, really working on that hip extension through that back leg, even though it's a seated exercise, it's also going to help your gait and your balance. That big reach up, maybe to get items from a closet or out of the refrigerator. And then you'll notice we have 3 exercises there stepping directionally. So if she's doing a forward step and a step to the back and a step to the side, these are working on making sure that you keep that wider base of support, that big amplitude movement in whatever direction you happen to be moving. And then you'll notice the last 2 at the bottom are getting into some weight shift. So, rotating the torso, shifting that weight side to side, also shifting the weight forward and back with a big reach to support those functional movements in everyday life of walking and turning and reaching. So this is a video here. We're going to take a look at an example of what these exercises look like from our homework helper.
Our next exercise is the step backwards and reach. You want to be sure to start with your big posture, and you're going to have big hands. And then we're going to do a nice big step back, big arm movements, and then come back and finish big.
And let's swing those arms. Big posture. Get up there. Big arm swings. There you go. Nice job, Bob. Reach, 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 reach. One more and big finish. Ready? Big twist. Good, good, good. You can actually have this one way out here, this one out here. Nice. And big finish. One more, just like that. Big twist. There you go. Nice job, Bob. And back. You got better with each one.
Okay, so we'll get the slideshow back up. You notice how the pictures that I showed before the videos, all of the exercises were in standing, but in the videos, we demonstrated you can do the exercises in a seated position. There's even a supine or lying down if people needed that modification for whatever reason. Or I've even used those modifications at times like the supine for training for big movements and bed mobility. So a lot of options to meet you at whatever your level is. So then often what we do too, if we're working on getting the hands really active to support that fine motor coordination, we want to make sure that we've got those big hands. And we're going to focus on that throughout the treatment exercises, just like you saw Jenny doing, and really watching out for that closed or that small hand posture. And one way that we can do this are hand flicks. And so it's almost like if you've washed your hands in a public restroom or somewhere and you kind of flick the water off the hands. It's to really engage and get the muscles active in the hands, kind of reset. I'll be honest, no one really knows why this works, but it seems to help a lot of people. So here's a video example of those hand flicks.
So first we'll start with the hand flicks, and you see a close-up here of Jenny doing hand flicks. And really pay attention to how she has her entire hand flick open. The second way to do flicks is to do an arm flick. Now you'll see a close-up of Jenny doing the arm flicks. And in addition to the fingers, we've added the movement of the arm to add some additional amplitude. Now watch as Jenny adds flicks to the floor to ceiling exercise. So we have our big to the floor, up, and in the sustained position, she flicks her fingers open 10 times, keeping that big posture, but flicking big with the fingers, and then ending big.
Excellent. So you could see how we can take those flicks and add those into the standard exercise protocol, as well as we might take those and put them in with your functional components before you start to do a button or practice a writing task as a preparatory exercise to kind of wake up the hands a bit. Looks like we're having trouble getting the slides going. There we go. All right. But then basically, if we've added all these things in, we want to really work on transferring that bigger amplitude of the movements that you learn through those exercises, like you saw Jenny doing, into function. And so if you think about that, we have to make it meaningful. We really want you to be motivated to continue to practice those exercises. So seeing how that forward step will help you step onto a curb. We have to help you make the link and really see how taking that big step to the side might be like you need to do to step down an aisle in a theater or to see a movie. Or maybe the big backward step is getting out of the way of an elevator. So as much as these might be exercises, right? They're specific to functional movements because we really want that personalized, purposeful practice of whatever is meaningful to you and how whatever task you need to improve to make your life more effective, more efficient, and as stress-free as possible. So how do we do this? Well, part of that program is always the functional component task. So basically, after you've gone through your 7 exercises, when you come in to work with us in the clinic, we're going to practice these tasks every single session. They're going to be simple, kind of one-step movements like closing a button or hooking a zipper or pulling your credit card out of your pocket, for example. They're always going to be selected and driven by what is motivating and meaningful to you. They're personalized to your program, even not only in what task it is, but how we're going to practice it, because we're going to look at how you do that task and where do we need to apply the amplitude to make it more effective. Throughout the course of your program, they are not going to change. So throughout the 4 weeks, you're going to continue to practice that task repetitively. And when you think about over those 4 weeks and all the repetitions, you do up to 300 repetitions, getting all that intensity and repetition of practice, and with added complexity. So we don't let them get boring. We're going to add challenges that you might meet in the real world. Maybe that's, walking while you're trying to text on your phone, or being distracted by other, voices or people in the room while you're trying to do a task. So these are some examples. These might not be your examples or what you would need if you came in, but these are ones that we see a lot. I've mentioned buttons and zippers quite a bit. For some people, it's hooking a belt buckle or clasping a necklace or a bracelet even. Sometimes sustaining the movement in a big way to brush teeth can be troublesome. And they have found some changes sometimes in oral health for people with Parkinson. So we know we have to work to maintain that too. Sometimes sorting pills when taking medications or opening bottles to take those, and even counting change or money. And you notice with all of these too, especially things you might be doing in public, if you add anxiety into that, like you feel like someone's getting, impatient or frustrated behind you when you're counting that change, that often makes the task even more difficult. So building up your confidence with all that repetition and practice will help you meet those challenges in a better way. So let's take a look here at how we train and practice some of these fine motor tasks.
Good, and I want you to just kind of notice as you're watching Bob do his buttons, it's a very slow, small kind of movement that he's using to try and get those buttons through the buttonhole.
Yes, we do struggle.
And this can be a very frustrating thing for a lot of people, Bob. You're not alone in that. Does the top button tend to be one of the hardest ones for you?
Yes.
Okay, good, you got it though. All right. Let's do it. Ready? 1, 2, 3. Go again.
Wow.
Really push it in hard. Nice.
About a third of the time.
You're right. Good job. Now go back in and close it like you're angry with it. Really push it in strong. Nice. How fast was that?
Even quicker.
Even quicker. You're right.
I haven't done a button that quick, and I don't know how long.
Good.
So you could see where in a case like that, where in the beginning he was taking 38 seconds to do that button. And even though he could do it himself, and a lot of times as an occupational therapist, if I might look at the doctor's notes, it might say the person's independent with dressing. But when the efficiency is impacted that much and it's taking someone that long, it's typically a slippery slope until you might need help if we don't intervene with that. And you could see how small the movements of his fingers were. But what was really interesting too, I hope you noticed, was that even though, it's buttons and she's working on that, there were a couple different strategies that she did. She tried the flicks, she tried the angry buttoning. And so when you come in, it's important that you know, as much as I might have worked on, with 20 people on buttons, my approach with you might be really unique depending on what helps you get that amplitude, what really helps you to find that efficiency and that effective movement. Okay. So now, if we think about these, more complex tasks, so our functional component tasks are practicing things that are more one step, more simple. How do we practice these more difficult tasks? So we call these hierarchy tasks. And all that means it's something that's more complex. It's an activity or a task that has multiple steps, but it's still functional and meaningful to your daily life. That is absolutely always number one. And these will be identified through discussion with your goals. So it might be that you're having, say, difficulty getting in and out of the car, or getting in and out of bed, things that involve more steps. That's where we start to see this. So, some examples here. Dressing, we talked about buttons as a functional component task, but if we think about it, sometimes, it might be more than just a button that's giving somebody trouble. Maybe it's actually putting on an entire pair of pants or threading arms into the shirt before buttoning it. When it starts to get into more steps, more tasks, more elements, we move into hierarchies. Also cooking. So this, can be grasping utensils, cutting, maybe moving in the kitchen as well in a safe way. For handwriting, a lot of times if it gets into longer passages or writing emails, things like that with typing can be a problem. So applying makeup or jewelry. But with all of these, the therapist has to watch you, and really talk with you and interview and see, is it just one element of the task that, kind of gets you stuck, or is it more elements? And that's where we can choose the activity then as a hierarchy task. So, also part of your program every time is going to be big walking. So, no matter if it's an OT that you're seeing, an occupational therapist, or a PT, a physical therapist, either way, we're still going to work on getting your functional mobility, your walking up. Now, we might have different ways that we approach it. So, as an occupational therapist, I might be looking more at maintaining your hands open or really getting more symmetry when you're swinging your arms. I might ask you to add some of the challenges that we're working on as functional component task or hierarchy task, like walking and texting or walking and counting change. But either way, we're going to work on that mobility, and we might also drive and work on some of the changes that you're having with the hands with your fine motor task in addition to those, if it's appropriate and safe for you. So then how do we do these carryover assignments? Because we mentioned those. It's a daily assignment all 30 days. So even we're going to see you 4 times a week, right? To do your exercises and your functional components and your hierarchies. But then you're going to have to practice on your own too. But we're going to give you a carryover that just fits into your plan for the day. So I might ask you something like, hey, what are you going to do today? What are you getting into? And if you might say, I'm going to visit my daughter, or just going home and doing laundry, or going to the grocery store, whatever it is, I'm going to take something that we were working on during your LSVT BIG program, and I'm going to ask you to incorporate it. So maybe it's a big reach with an open hand to retrieve something from the shelf at the grocery store and put it in your cart. Or maybe it's a big grasp when you're taking laundry out of the laundry machine at home. So I'm going to make it fit what I'm trying to get you to practice and do on your own into your daily life following therapy. And this is going to help address that sensory problem, because we want you to start to notice how big your movements need to be big enough to be efficient and effective. And so it's taking what we're giving you feedback in the clinic as therapists and having you practice it and apply it on your own. And we're going to mandate specific tasks with specific feedback from other people or from yourself. So now we're shifting that feedback coming from the therapist, and either we want your spouse to comment on it, or a friend to be like, wow, that was, your posture looks really different, or your voice sounds so loud, whatever it might be that we've given you to practice. Or maybe it's just that you note yourself that I did my big reach on my sit to stand and I got out of my recliner the first try. And these are also going to progress in difficulty over the 4 weeks. So I mentioned how with, the functional component tasks, the hierarchies, we're going to be adding in those real world challenges. Even with your exercises, you might start out doing some of them holding onto a chair. Maybe the progression of difficulty is doing them without needing to hold on, or maybe stepping on balance challenges, or doing cognitive dual tasking, having to, think of different animals while you're doing your exercises. We're going to do that throughout all of these. And so your carryover assignments starting at day 1 will look very different from your carryover assignments in week 4, when maybe now, instead of just using that big grasp to get the laundry, I might be working on you with big posture when you're carrying the basket, a big reach and grasp, a big, sit to stand when you stand up from doing the laundry, whatever it might be. We're going to give you more elements. So here's some examples of what some different fine motor carryovers might be, right? So if we think about it with week 1, I talked about that complexity. You might just be opening up a pill, or picking up pills, or picking up a fork, or buckling your belt. So very simple ways to approach that. By week 2, then maybe we're getting more into, putting dishes away with a big grasp, a more complex task, clipping your nails, buttoning the entire shirt and cuffs, not just one button. By week 3, we might really be getting more complex by, writing or typing a letter or email, keeping your posture big, keeping your hand movements big, maybe changing a light bulb. If you think about that, there's a lot of elements going on when we have to change a light bulb that might be climbing and reaching and using the hand to manipulate the bulb. But then by week 4, if you notice here, that big grasp in grocery shopping has turned into, now with big manipulation of the money, a reach and grasp when we're putting the groceries away. So really adding on more and more complexity, because the idea is, if possible, you're starting to be able to think about applying that amplitude more and more through your daily task. So what we've found as well is that just generalized changes can occur too. So this is a handwriting example that the person did not work on handwriting. That was not one of their tasks. That was not one of their components that they were doing. But in the end, when she had them write down their different things they had wanted to work on, sitting for a long time, rolling in bed, and getting off the floor, these were the things that got better. So you can really see that the writing improved as well as practicing the task too. So you can just see some generalized changes. We also hear a lot of anecdotal reports. So a lot of times it's, other therapists tell us like, wow, I was really able to work with someone on playing their instrument and applied, this amplitude to, moving their fingers to turn the pages in a book, or shuffling cards, or getting money out of their wallet. And they were able to do these things better and more effective and more efficiently. So we hear reports from the field, so to speak, that there are a lot of different things that people find to work on, but they're able to apply the amplitude of BIG and get more success in their LSVT BIG program. So what does the research tell us? Let's take a quick look here. Basically, we want you to have these kind of 6 take-home points from what we've seen in the research recently. The number one, we talked about this earlier, fine motor control impacts function for people with Parkinson's. We know that, 75% of people report that micrographia, or those changes to their handwriting. The tasks that you choose to train on in therapy should be functional and meaningful to you. We really see from articles, there's one down at the bottom, the Cabrera Martos, where they compared people doing goals that were meaningful to them with their hands and arms, like buttoning a shirt or getting dressed, compared to just rote exercises with the hands, using putty or things like that. And they found the group that did the meaningful task improved much more. So that motivation is so important. We know that it's really important to focus on the bigness and the amplitude, not speed, when we're training fine motor coordination. Typically, when you try to go faster, the movement breaks down more. And so you kind of trade speed for accuracy, unfortunately. They've even found this in freezing of the upper limb when people have difficulty with their feeling like their arm gets stuck when they try to move a fork or spoon or write, that it's really about driving the movement bigger, not trying to go faster. And the practice, we know from all the research we're saying, needs to be intensive. So for some of the handwriting studies, basically, it's been like 5 times a week, for a long period of time, half an hour to an hour of practice. Now, with your LSVT BIG program, when you're doing those functional component tasks and hierarchy tasks and carryovers every single day, you're getting that intensive practice of that writing or of those fine motor tasks. And we know now that, we're seeing more and more that LSVT BIG has the potential to really help improve the sensory processing. There was a research article that really showed that people had better proprioception when they had done LSVT BIG. And that's really feeling where their arm was in space on pointing tasks. You think of that with like texting or, keyboarding. They found that people really improved in that to help their fine motor task through this calibration training. And continued practice of those fine motor tasks is so important. So it can't just stop when therapy ends. That would be almost like, going to the gym, and then when you quit going to the gym, just not exercising anymore, but thinking you should continue to get better. You still have to do the exercises. And when we're looking at fine motor tasks, your quote exercises are your fine motor activities. It's texting, it's writing, it's taking things out of your wallet. You've got to continue to practice those. And I even encourage people to find fun hobbies and tasks related to fine motor. There's a lot of different crafts or woodworking or art that you can use and practice a lot of those skills as well. So in summary, we know that these fine motor control difficulties are very common in Parkinson's disease, and they can impact your ability to perform a lot of your activities of daily living, and really affect efficiency and ultimately independence in your daily life. There is more and more, research coming out, but still we need to know more about effective treatment interventions for fine motor control issues. But we're starting to get more and more data, and it's helping, I think, to refine how we use LSVT BIG and how we approach. It's really reinforcing, I think, for us what we've known for a very long time. LSVT BIG is one treatment which can increase your independence and speed and quality of life with your fine motor tasks that you're using in everyday life. So we hope that you'll, think about it and consider it as part of your possible, exercise routine to really keep your participation and function optimal throughout your Parkinson's disease journey. So how do you get started with LSVT BIG and Loud? Well, first you ask your doctor for a referral and a prescription. For if you're doing LSVT Loud, that would be seeing a speech language pathologist. Or if you want to do LSVT BIG, you would see physical and or occupational therapy to get an evaluation and treatment. It's very important to know though that the script doesn't have to say that. So the doctor can just say, just give you a prescription for speech therapy or physical and occupational therapy, and then the clinician can decide with you, collaborating with you on if it's the right treatment for you. You can also visit our website here at lsvtglobal.com to find an LSVT Loud or BIG clinician in your area. There's a big button and you can put in a mile radius and find clinicians in your area. There's also homework helper videos. So we do encourage you to do the program first with a certified therapist so you really learn how to apply the amplitude. But once you've gone through that, and I think we had a good percentage of you in the group today who have done BIG, and maybe you need a little refresher or re-energizer, and you can download this or purchase the DVD to help with your daily practice during and after BIG. A lot of people purchase this to support their practice during the program. It's available in both the standard or standing and adapted versions with the seated and supine. You can find it on Amazon as well as in our LSVT Global store. And after you get you do this, we really want to support you, because our hope is we know the improvement that we see in people who continue to do their LSVT BIG program over time, and we want to support you in being able to do that as well. So like I mentioned, that homework helper DVD you can purchase or download. We have new group exercise options as well, like Loud for Life and Big for Life, that are done in a group class format, and there are some online versions of those as well. We recommend that, just like you see your dentist, you get a regular LSVT tune-up, and that might be every 3 to 12 months, depending on your needs. If you're doing really well and you've continued to do your exercises, maybe you're earlier in your Parkinson's journey, it might be spread out to about 6 months or a year. But if maybe you're having more difficulties, or maybe you quit doing your exercises, you might need to be seen earlier. And then always we're gonna, as your clinicians and as your therapist, help you find enjoyable fitness for Parkinson's in your community and in your area, so we can support you and for having some variety too. So this gentleman gave a great quote here in Testimonial about his program, and you noticed here that there were some activities that he had been avoiding, and they were, after doing LSVT BIG, they were part of his program. So getting up from a low couch, sit to stand, is always one of the functional components we work on. Getting into and out of his car, putting bills in his wallet, getting his cell phone and putting it back, and then also getting his shirts on. And he did all of that in 4 weeks. So you think about maybe all the different areas of difficulty you're having, or maybe places where you want to prevent any difficulty from happening, and we can really target that amplitude and improve your overall function with LSVT BIG. And so with that, I'm going to hand it back over to Laura.
All right. Thank you, Julia, so much for that great summary of LSVT BIG. If you're interested in learning more about what LSVT BIG and what LSVT Loud are, you can surely visit our website or blog. There's a lot of information. There's webinars like this that have already been recorded that you can find on demand. There's a section on our website specifically for patients and family. If you're a therapist, there's information on training and certification as well. We also have different blog articles, testimonials, and videos on people with Parkinson's who have gone through the program. So be sure to check it out. If you have any specific questions related to you, you can always email us and we can provide you with a direct answer as well. There's also a number of resources nationally and internationally that are fantastic if you're wanting to learn more about Parkinson's disease, and we've listed just a few here. This is not an all-inclusive list, but just a few ideas to point you in the right direction of where you can get some really useful and accurate information. So we will take a couple of minutes for questions, and Julie and I are happy to stay on longer. If you have to leave, that's totally okay. I know that you all have busy days, and we just are grateful for you joining us today. We do have a webinar in June geared again towards people with Parkinson's, families, and caregivers. This will be on Wednesday, June 23rd, and it's really about this topic of calibration that we mentioned today, which is truly the heart of success for LSVT BIG and LSVT Loud treatments. Our May webinar is geared more towards clinicians who are not certified in LSVT. So if you're a clinician joining us today, be sure to go on our blog, go to events, and you'll find that upcoming May webinar. So if you'd like to stay on and ask a question, there's a couple of ways that you can do so. One is to type your question into the control box, speaking of fine motor, fine motor skills, right? But you can certainly do that, and we'll read your question, and either Julia or I will do our best to answer it. If typing is a bit tricky for you, there's an icon on your control panel that looks like a hand. If you click on that, it's essentially raising your hand. Julie and I will find out who is raising their hands and unmute your microphone. You have to make sure that your microphone is not muted as well, and you can ask your question out loud. If you're leaving right now, just remember to complete the survey and let us know if there's anything else that we can do to support you. So, Julia, I'm just seeing if there's any questions that have come in yet. We'll certainly give you a couple of minutes to ask your questions. I think there's one question, Julia, that I can ask to kick this off while we give people some time. What about tremor? We really addressed small movements, but we know tremor can really impact handwriting and a number of things. So what would you say, does LSVT BIG help tremor? And if not, how do we handle that? How do we address that?
That's a great question, and unfortunately, we haven't found the magical cure for tremor. I think for one thing, though, what I've seen a lot with LSVT Big is when people truly have a resting tremor from Parkinson's disease. So a resting tremor is when you're sitting with the hand in the lap, right, just resting the hand, and you have a tremor. An action tremor, which you can see with Parkinson's, but we tend to see more with like essential tremor, that is when you go to use the hand, you see the tremor really kick up. So if someone has a resting tremor with Parkinson's, the activation and engagement through the hand and arm often does offset the tremor because it's not resting anymore, right? That hand is really driving and active. For people with it more of an action tremor, we got a question the other night about this. Sometimes in the beginning, the other therapist had noted as well that you'll see the tremor will almost be increased. It's like the system is being challenged a bit, and so the tremor goes up that first week or so. But then what was interesting was my client anyway was saying was that at home after the sessions, the tremor was less. And then as the weeks went on, the tremor became less. So it really depends, I think, on, the type of tremor that you have. Is it resting or active? And then also, kind of what your triggers are with the tremor. There has been some research even around an action tremor with essential tremor, even where exercise and doing like some strength training, resistance training, those kind of things, which we get with some of these exercises for sure, does help tremor as well. So I think it's one of those things that you have to try. There's not, unfortunately, at this time, anything that magically eliminates tremor completely. But a lot of people, I think, find that they can manage it and reduce it with exercise and with activity and some positioning strategies.
Great. Thank you, Julia. Here's a question about, I just lost my control panel. Have you dealt with people that have high co-pays and want to do an intensive treatment like LSVT BIG? Maybe, and this person also said they work full time, so are really busy. Any advice on solutions that you found there that or ways of thinking about that?
Absolutely. So things that we did at our site in the past is we did have like a, I don't want to say charity care, that's not the right word, but we did have for people who had a high copay, a way that they could apply for financial assistance for the copays. And then what we would also do too is, when appropriate, if they were getting multiple services, like say they were coming in and seeing PT, OT, and speech in one day, then they would only have one copay. And then also a lot of times we were waiving some of the copays during the week. It is a tricky issue as far as around work. What we would often do is see people earlier in the morning before work or later in the afternoon after, depending on your work situation too. We've had school teachers before that would kind of wait and do LSVT BIG in the summer. So maybe there's a time in your schedule that you feel like you can more fit it in. But I think that it can really be helpful, and talk to the therapist, talk to the site you're thinking about going to, let them know. I think advocate for yourself that I'm going to need times before work or after work. My copays are high. Is there any help or assistance? And even sometimes local councils, like if you have a local Parkinson's council, they sometimes have programs to help with offsetting cost for therapy and exercise.
Perfect, perfect. And I would add to that too. Check it out. More and more therapists are offering the option, when appropriate, of doing LSVT Big for through telehealth,
Mhm.
and that can be really helpful to people that are working full time and maybe can squeeze in a session more easily in the evening at home or over their lunch break at work too. Okay, can we have a replay in French? I'm sorry, I don't think GoToWebinar has that capability, but we do have some resources in French. So if you'd like some different handouts and things like that, email info@lsvtglobal.com and we're happy to send you what we have. How does pedaling for Parkinson's help those with PD? Julia, are you familiar with that program?
It's based off the J. Albert study, right? But I
Mm,
don't think
I
they
think so.
necessarily do the 90 revolutions per minute. Is that correct?
I believe so. I don't want to speak too specifically on that.
Mm,
I think there's a ton of research on the great benefits of cycling in
mhm.
people with Parkinson's, forced cycling and tandem cycling. Again, like Julia said, the J. Albert's work. I don't know how that impacts fine motor control specifically, but I would do a PubMed search and look a little bit more for that because there is really good evidence for cycling. Next question is, I'm an occupational therapist. I add to the LSVT routine the elastic bands to grow up the difficulties of the exercises. What do you think about this?
I think the only thing you have to watch with the bands is how they're holding them.
Hmm.
Because the downside is that is if you're having to grip and hold it the whole time, then we're kind of promoting that closed hand posture, which we don't
Hmm.
really want. So I'm not sure if you maybe have them on handles to where they can still, open the hand. Um, but I think you always, for me anyway, and I think this is just a general blanket statement. I'd love to hear what Laura has to say too.
Hmm.
But, I look at what am I challenging
Hmm.
and why am I challenging
Why?
it?
Hmm.
So, for example, a lot of times we know that people with Parkinson's don't have issues with strength,
Hmm.
right? So it's more, if I'm challenging somebody to open their arms out to the side and really abduct, and now they're also going against a resistance band. Am I promoting a closed hand? Is it making it harder for them to open up their posture, to
Hmm.
do that? Or is it supporting it in some way? So I think you always just want to look at, does the challenge that you add in do what you want it to? And really think about
Hmm.
what it is you're challenging and why.
Hmm. I,
Does that
I
make sense, Laura?
totally agree with that. The rationale of why we're doing what we're doing is what makes us therapists. And I really can't emphasize enough, you know, how important it is for us to know our patients and know what they do in everyday life. And if I have a person that's working in construction and doing a lot of heavy lifting and things like that, then yeah, that might be a perfect challenge to add cuff weights on, or resistance bands. If you can get them from rolling, you could try rolling, putting them around their wrist, but they oftentimes roll up. If it's someone that's more in a job that requires a lot of dual tasking, I'm probably going to lean more to dual tasking challenges, thinking, talking, writing, texting, those kinds of things that they do. And many of us live in worlds like that where we do lots of dual tasking. So that will drive your decision of the challenges to add.
Yeah, I think that's a good point. Is we're always trying to think of like what is in the real world,
Hmm.
what challenge are they going to meet there, and how do I replicate it as much as possible?
Yes, that's right. All right. Well, I think we got through all the questions, and I'm so glad that all of you hung on here and listened to the questions. Again, this is being recorded. This will be available on our webinar in a couple of days. But if you think of additional questions or you have topics that you'd like to see us present in the future, please do reach out to us. We really treasure your feedback and information, and we'll hope to see you next time. Thank you, Julia.
Thank you all. Thanks, Laura.